Welcome back to Insight Indonesia, brought to you by the Jakarta Globe. Today I'm talking with Dr. Julius July, a staff neurosurgeon at Siloam Hospital in Lippo Village, Karawaci. In the last segment, Doctor, we were talking about brain tumors. Why don't you open our head and give us a little tour of where tumors might be located and what goes on inside the brain.
Okay, so if we look at the head, if we open it, we can see before we actually see the brain, we may see at the first part is, of course, after we remove the bone, we have to cover it what we call dura. This also can arise some tumor like meningioma from the dura. Okay. Beside that, and then after we remove the dura, and then we can see the brain. A big part of the brain is, of course, we can see the, what we call it, the big brain, the cerebrum, and the small brain inside. This is for the balance and everything. So the tumor itself actually can arise any place, any part of the brain. So the symptoms, like if there is a lesions arising at the brainstem, will cause a lot of problems. Depend on what functions that involve and that particular locations. So in some other tumors, it might involve with the hormonal, because we have a gland, what we call a master gland, the pituitary, near the ear.
Well, that's where the pituitary gland
Yes,
is.
yes.
I never knew that.
Yeah, the pituitary gland. A very small gland, but it functions very important. All the hormones is regulated by that small gland. It also can arise a tumor from there.
Wow.
Yeah.
Now, when you start to treat someone who has a tumor,
Yes.
what are some of the tools at your disposal that you didn't have before? What are some of the technological advances that are now available?
Before that, is maybe 10 years ago, we don't have all the basic thing. But now we have all the basic thing. What I call basic thing is not a fancy thing. It's a required things to do a safe surgery. Like we have navigation system, and then we have neuroendoscopic, which can we do minimal invasive surgery through the nose without cut from the head. And also we have, now incoming, we have gamma knife.
You have a gamma knife now.
We will have gamma knife next month.
Now, what is it? People say now, Siloam, I know, has gotten a gamma knife, and it's hugely expensive.
Yes.
What is it exactly? What is a gamma knife?
So the gamma knife is actually a radiations tools for certain locations, lesions. Before that, if we radiate patients, we will radiate like pull a whole dose, expose the normal brain with high dose of radiations. But with the gamma knife, we actually put a very small dose with like a spike, and then at the center of the spike, we have a high dose.
So you can actually pinpoint where you need to go.
Right.
It's kind of the difference between a shotgun and a sniper rifle.
Yes. You're right.
You don't have to shoot the whole room.
Right, right.
And I would imagine that means that, again, if we're going to stick with the war analogy, less collateral damage to the surrounding area.
Yes, yes, yes. It's make it safe, make it precise, but it's not work for every lesions.
Sure.
Yeah, only certain lesions that we really indicate.
And when will that be operational?
I think next month.
Next month.
Yeah.
First time in Indonesia?
Yes, that's first time.
This is interesting because, you know, as you know, frequently healthcare in Indonesia gets a bad name from the public. And it sounds like what's happening, at least with your area of things, is that you're getting the equipment necessary so that if you do have a diagnosis, if you're troubled and sick in this way, you can get treated here.
Yes. The problem with that, I think, a lot of public doesn't know what we can treat now in our center. So still a lot of people doesn't know what we can achieve by having all the tools and all the skills that we have. And of course, it takes time to prove it to public. And so far, more and more people already have the service and all know the result and the complications that we have. is almost equal with all the developed country. And we also publish a lot of papers from our side that showing that even we involved with a book chapter and everything, that showing us what we achieve is actually equal with developed center.
And I have to believe that for a lot of people, that means they can actually afford the treatment.
I hope so.
Whereas it's not everybody who can afford to fly to Singapore or to the United States for treatment and pay cash. So this gives people more access to something that's more affordable. Well, we're just about out of time for this segment. When we come back, I want to talk about strokes, and I want to talk prevention and what people need to be aware of as they care for their brains. You're watching Insight Indonesia, brought to you by the Jakarta Globe. Stay with us.